The Affordable Care Act, aka Obamacare, was enacted in March 2010. The law prohibits insurers from denying coverage to those with pre-existing conditions. It also raises the threshold for Medicaid coverage, so those earning up to 133% of the federal poverty level can still be covered through Medicaid. The law also includes mental health care as one of 10 essential benefits that all marketplace plans must provide. And that helps bring those plans closer to coverage typically provided by large employers. Experts say all these benefits are significant, but as you might have heard, Obamacare has had some problems. The Affordable Care Act created a marketplace. Think Amazon for health insurance. It's essentially a price comparison website where individuals and businesses can compare the insurance cost of different providers. But many large insurers like Aetna and UnitedHealthcare are pulling out of these marketplaces after reporting millions in losses. And insurers still in the marketplaces are raising premiums largely across the board to cover costs. President Barack Obama has admitted that the Affordable Care Act has, quote, real problems, but he says congressional gridlock has prevented real solutions. That being said, about 20 million previously uninsured Americans have gained coverage under the act. So let's look at the candidates' position. Republicans, including Donald Trump, have called for Obamacare to be repealed and replaced. Trump says he will rely on free market principles to govern the healthcare system. He says insurers should be able to sell across state lines, and states should manage Medicaid without federal overhead. Democrats, including Hillary Clinton, have acknowledged Obamacare's issues, but they say the Affordable Care Act should be defended and improved. Clinton plans to lower the Medicare enrollment age from 65 to 55, expand access to rural Americans, and double funds for community health centers. And in a nod to Bernie Sanders, she will fight to include a so-called public option of fully government-funded insurance. So, should the Affordable Care Act be improved, or should we do away with it altogether and hope for a better option? Take your decision to the polling stations November 8th.